that OCD takes an average of 17 years to be diagnosed, and that it is higher in women than in men, and that it starts to be noticed between the ages of 8 and 25 years. Well, join me for this discussion. My name is Nancy Wanjiru, and I'd like you to subscribe, like, and share our mental health video, and keep following us for more updates in the field of mental health. OCD is an anxiety disorder that causes a person to have intrusive and recurring thoughts that influence their behavior or makes them feel so uncomfortable that they have to take up an action to try and suppress those feelings. OCD causes intrusive thoughts that cannot be resolved by logic or reasoning and impairs work and social functioning. It causes compulsions that are experienced and are recurrent and persistent. These are thoughts and impulses or images that cause distressing emotions such as anxiety or disgust. These compulsions are time-consuming, meaning they take more than an hour in your day. They are controlling behaviors which are rigid, meaning you perform the same action every time when you have these intrusive thoughts. This person will try to cover up their obsession or their behavior. They will have repetitive behaviors such as hand washing, checking on things or cleaning, which interferes with the person's daily activity and even social interactions. Someone with OCD will develop behavioral tics such as shrugging their shoulders, clearing their throat, blinking, or even twitching in their eye, around their lips, or some body parts twitching. There are types of OCDs or symptoms of OCDs, and you may have noticed them as contamination, doubt or harmful thinking, forbidden thoughts, perfectionism, staring, relationship, and existential OCD. I will focus on the first 4 types of OCDs. With cleaning and contamination, you have someone who is obsessed about cleaning, washing, disinfecting due to fear of contamination or germs, including specific cleaning or washing rituals. They may wash their hands, scrub surfaces, and they have a routine and the number of times that they have to do this in a given day. So they do this religiously. You will find these people having some compulsions and even some items that you may not see them as dirty, they will throw them away. They will have thoughts about feeling dirty and unclean, even mentally, in places where you can't see. So they will keep talking about decluttering, things that they need to align, and they have persistent worry about germs or sickness. The second one is symmetry and order. You'll find this person has a need for symmetry in all actions. They will scratch their right hand and scratch their left hand just to have that balance. They will have an extreme need for symmetry and organization of items such that they will align them according to size, according to color, according to the shape and design of that object. They will have counting rituals such as needing to count a specific number a certain number of times. They'll have feelings of incomplete when items are not exactly where they want them to be or how they want to be, and hence the compulsion to arrange these items, and they do this religiously. They will sometimes have magical thinking or believing that something bad will happen if they don't arrange or organize things the right way, and they keep looking for that feeling they call just right. For those who have forbidden thought OCD, they'll have compulsion to hide things that you could use or they deem as weapons. They'll have frequent thoughts which are intrusive about sexuality or sexual in nature. They will think about violence or see violence being or happening to them, and they will worry that someone is about to harm them, planning to harm them, or planning to harm someone close to them. They will frequently review their daily activity to make sure that they have not hurt anyone. They will guilt or shame others in distress about the thoughts that they are experiencing. They will have an obsession about religious ideas and even feel blasphemous or wrong. They will have persistent questioning about their sexual orientation, their desires, or even sexual interests. They will worry that you will act on your intrusive thoughts, or they will act on their intrusive thoughts and having them making or looking like the bad person. They will seek reassurance and won't act on intrusive thoughts as much as they are there. They will seek reassurance that they are not a bad person. The fourth type is hoarding, where you find someone has a compulsion to buy multiples of the same item, and even when they don't need to have that many. So you find someone who loves to wear white shirts, who will buy 5 or 6 or 7 of the same white shirt. A lady who loves a particular color and design of a shoe may end up buying more than one pair. So they could have 3 to 7 or more than 7 pairs of shoes, and it could go to bags as well. You find that these people have a difficulty throwing away things or touching them because they feel that it will cause contamination. They will collect certain number of items to protect themselves or someone else from harm. They may have extreme fear of throwing away, say, receipts, books, and as much as they may be done with that particular course of school, and they are notebooks or diaries or journals that they had written on, because they are afraid of throwing away important information that is essential, and they are afraid that it could be caught by someone else by accident and it may result to harm. They have feelings of incompleteness if someone gets in possession of these materials that they threw away, and they go through an extreme anxiety. OCD occurs with other conditions such as attention hyperactivity disorder, and this is because of that obsession. So you may find your attention, say, in class or towards a particular role pulled away because you're obsessed with a thought that is intrusive. It also occurs with major depressive disorder, where you find challenges because your demands are unattainable, and so you're not happy or you don't get to enjoy or live a fulfilling life. They also come with social anxiety disorder, because these behaviors make you feel awkward or people perceive you negatively, and intrusive thoughts could start telling you how you're being judged or how people are perceiving you. And you could also have some eating disorders because of the fear of infection or germs. The most effective therapeutic approach to OCD is CBT, where you are taught and your therapist will use exposure and response therapy also to help you talk about how to overcome these challenges that are associated with your thoughts and wear down on the compulsions.